Okay, so good afternoon and welcome everyone. I'm Sue Hass-Miller, Senior Advisor for Nursing at the Robert Wood Johnson Foundation and Director of the Future of Nursing Campaign for Action. Thank you for taking the time today to be on this webinar and the fourth round of funding for the Nursing Innovations Fund. This round focuses on advancing health equity and combating systemic racism. I've deep gratitude for all of you, for all the work that you've done. You've stuck with us. It's so great. I'm so proud of everyone. Everything you've done to improve health through nursing and for your determination to improve our health system and advance health equity. So thank you for your leadership and determination to change our country for the better. I know that's why we're all in this, right? The COVID-19 pandemic and the renewed movement for racial justice have underscored the need for our country to advance health equity and give everyone a fair and just opportunity for health. This is the future of nursing. This is the issue of the day, right? We want to, so the National Academy of Medicine will release a long-awaited report on May 11th that will guide us in charting a path to advance health equity. We want this round of Nursing Innovations Fund to stimulate new solutions for achieving health equity. So the timing couldn't be better. We've planned it this way, of course. Solutions that align with the new report. This webinar is being recorded and will be available on the campaign's website. Please use the chat function to share ideas, make comments, or ask questions throughout the call. And as usual, our staff are standing by to answer the questions if I can't get to them. Please be advised that any question will be answered during the Q&A portion of the presentation. We're going to get to all these, whether we do it online here or after the facts. During the Q&A portion, use the raise hand feature and we'll call on you. To ensure the best audio, and as I've said, please keep your lines on mute. Okay, so now we have Jennifer and Winifred as part of the program director staff. Jen and Win, were you going to say anything or do I just continue from here?
You keep going. We'll help you with that Q&A.
Yeah, I think I just continue. Okay, so great. So, so before I explain details for this year's Nursing Innovations Fund, I want to share some background. This is a very devastating chart that I use a lot. The COVID-19 pandemic has magnified the deep-rooted barriers to health and opportunity in the United States, particularly in Black, Latino, Pacific Islanders, and Indigenous communities. So I'm going to give you a few minutes to look at this and digest it, but I think you know what this is implying here, that the hardest hit people in our country were those of color. So especially adjusting for the data for age differences and race groups, this widens the gap in the overall mortality rates between all other groups compared to white and Asian Americans who have the lowest age-adjusted rates. Pacific Islanders and Latinos have the highest age-adjusted mortality, followed closely by Indigenous and Black residents. And that means that more Pacific Islanders and Latinos are affected. Okay, go to the next slide. I'm reading first from some notes that I have here, and every time something comes into the chat, it covers my notes. So if people can hold on for a little bit, that would be helpful. I've never had to ask that before. People of color have been disproportionately affected by the pandemic, both in terms of getting sick and dying and being economically affected due to a myriad of factors. We know that health is generally influenced by non-medical factors, and you can see all the factors here with the slide with the little girl eating her apple, things that we've gone over many times, such as access to jobs that pay a living wage, safe housing, reliable transportation, walkable neighborhoods, good schools, fresh food, and adequate green spaces. Next slide. Compared to whites, Blacks and Latinos are more likely to live in neighborhoods that lack healthy food options, green spaces, places to exercise, safety, and have more pollution. This is due to structural racism, defined as a system in which public policies, institutional practices, cultural representations, and other norms of work in various, often reinforcing ways to perpetuate racial group inequities. For example, many of the neighborhoods that Black people live in originated in the early 1900s due to redlining, and that's deliberate policies that kept Blacks restricted to certain areas of the community that lack social and economic resources. Latinos are more likely to live in crowded housing, take public transportation to work, and be essential workers. They are also more likely to lack health insurance and be able to access care. Consequently, they cannot follow recommended social distancing guidelines as easily. Next slide. So these structural inequities and the stress from experiencing racism lead to poor physical and mental health. Blacks and American Indians, for example, experience more chronic health conditions sooner, which also puts them at higher risk for COVID. Next slide, please. The United States must also reckon with our racism. The brutal killings last year of George Floyd and Breonna Taylor by police officers and Ahmaud Arbery by white men while running, and the unconscionable long list of Black victims who preceded them, as well as the over 3,800 reports of hate incidents against Asian Americans and Pacific Islanders this year, underscore the need to adequately acknowledge, confront, and dismantle systems of structural racism for all of our populations. We must all commit to a more just future. This will be the future of nursing. This is the seminal issue of our day. Next slide. To guide us, the National Academy of Medicine will release a second report on May 11th called The Future of Nursing, 2020-2030, Charting a Path to Achieve Health Equity. The committee overseeing the report will task a chart for our profession to help our nation build a culture of health, reduce health disparities, and improve health and well-being of the U.S. population in the 21st century. NAM delayed the report to take the lessons from the pandemic into account. RWJF is underwriting this report. And please sign up for, you can see the link here, please sign up for the NAM alerts and to attend the report briefing from 3 to 4:30 on May 11th. And you'll also be able to receive educational materials along the way. Next slide, please. Now, let's review the eligibility criteria for the Nursing Innovations Fund. Applicant organizations must be a member of an action coalition. We always restrict our funding this way, which is good news for you all. Be a member of an action coalition or of an approved organization affiliated with an action coalition. Evidence of approved organization should be in the form of a letter from the action coalition supporting their application to lead the project and describing the role of each partner organization in the project, of course, including the action coalition. And the approved organization must show evidence of how they will engage the entire action coalition throughout the project. Preference will be given to applicants that are either public entities or nonprofit organizations that are tax exempt under Section 501c3 of the U.S. IRS. You must also secure matching funds up to $25,000. I love it when you go over, but that's what you have to match. The matching funds must come from sources other than Robert Wood Johnson Foundation and can be in hand or demonstrated through a letter from your prospective funders that confirms their commitment to funding you for the project. In-kind donations are wonderful and great and very, very valued, but will not count as matching dollars. If there are circumstances that necessitate the matching funds do not align with the project timeline, please explain in the application. Your proposed project should advance and enhance nursing's role in promoting health equity and a culture of health by addressing policies relating to structural inequities, preferably structural racism, and or in one of these priority areas: access to care and services, housing insecurity, food insecurity, social isolation, poverty, low income or employment insecurity, or educational attainment. Your proposed project needs to show evidence of using the Future of Nursing Campaign for Action Health Equity Toolkit in your strategy. And I know I was talking to the staff yesterday. Hopefully you'll find it's a very, very good time for securing matching funds around health equity. With being in the philanthropic community, I know that just about every foundation, large and small and local, really have devoted funds to health equity because it is such a very, very important issue. That includes the regional action grant makers called RAGs. If you go to your website in your state, look up regional action grant makers. Regional Association of Grant Makers, excuse me, Regional Association of Grant Makers. You should find a lot of support with them. That's what I'm hoping. So let me see, next slide. In addition, we want you to show your proposed project could be replicated and sustained by you or other action coalitions. Consistent with our WJF and AARP values, this program embraces diversity and inclusion across multiple dimensions, including race, ethnicity, gender, age, sexual identity, and socioeconomic status. We strongly encourage applications that will help expand the perspectives and experiences we bring to our work. We believe that the more that such diversity is included in these efforts, the more successful we will be in building health equity and a culture of health, enabling all in our diverse society to lead healthy lives now and for generations to come. So preference will be given, as I said before, to action coalitions with a co-lead who belongs to an organization represented by the campaign's Equity, Diversity, and Inclusion Steering Committee. So you may have questions about that as well. And those include all of the minority nursing associations in our country. If you have received a previous Nursing Innovations Fund Award, you're still eligible for this round of funding. So that's good news, I hope, for everyone. Next slide. The Robert Wood Johnson Foundation Culture of Health Framework emphasizes the importance of cross-sector collaboration. This is really, really important, and it's gonna give you, some extra leverage, not to mention some extra points, I would think, on your applications. So cross-sector collaboration and building effective relationships. Working together with community partners and social justice organizations, action coalitions will be able to influence policy solutions and have greater impact. To help achieve the goal of broadening your reach, you might consider the following for your project. You should use this opportunity to, one, collaborate with partners that have similar goals, local health departments, housing authorities, schools, and businesses. Two, join forces with other effective campaigns and community-based organizations whose issue is health equity as well. So join forces. For example, these are things called the Root Cause Coalition or the National Center for Complex Health and Social Needs. Three, look for alternative funding sources through corporate giving, state or federal grants, or individuals. Or four, work with non-nursing partners to promote mutually beneficial policies that will lead to greater improvements in health and well-being in your state. Action coalitions can focus on policy solutions at any level, small p, big P, including public policies at the local, state, or federal level, or policies in the private sector. Maybe you're a big health system. So next slide, and this should be a map of the Nursing Innovations Fund awardees. So here's the map of the Nursing Innovations Fund awardees from our last three cohorts Of those awardees, we would like to highlight a few projects that address structural inequities and are priority areas. So some examples: Wisconsin, I'll pull out Wisconsin Action Coalition's project preparing Wisconsin's nurses to address the needs of vulnerable populations in a public health emergency. Included designing and developing trainings for Wisconsin nurses in response to the specific educational needs created by COVID-19. Trainings and address disparities impacting Wisconsin's most vulnerable populations. By partnering with a local community organization that was trusted by the target neighborhoods, they chose health system partners that the community wanted to work with. I'm going to pick out a couple more. I'm going to pick out Georgia. Their project promotes educational attainment and employment opportunities in nursing through what's called the high school to higher education, increasing Black male representation nursing project. They are partnering with the local EMT departments as well as the Atlanta-based chapter of the National Black Nurses Association. The Arkansas and Tennessee Coalition, an example of two action coalitions, we'd love to see this again, that came together with a joint proposal, which is to develop nurse leadership and places nurses on local housing and planning boards through the Arkansas, Tennessee Delta region. I love this one, to help create healthier communities. This geographic area has a history of inequities, poverty, and poor health outcomes. They are working with the Housing Authority to bring nursing leadership to community boards. That's really great. North Carolina, another good one. North Carolina Agricultural and Technical State University School of Nursing and Cone Health are using the campaign's Health Equity Toolkit with local faith-based communities to identify policies they feel need to be addressed in order to improve the health in their communities. Okay, next slide, please. We want to help all applicants with the targeted assistance that will help you achieve your goals. This is always the business that we're in, is to help you succeed. As we have underscored, we will provide you with ample assistance regarding your diversity work. We're ready to do the same for those of you who want more assistance on coalition building, fundraising, and communications. We have consultants who can help you with coalition building and others who can help with fundraising. So please, we really do want you to take advantage of all these consultants that we have on hand for you. I do need to point out that the fundraising consultants can help you develop your messaging and identify who to ask for funding. Yeah, but that's right. But they are not, I just want to make sure I had this right. Yes, absolutely. But they're not available to write your grant applications, but we certainly can review them. We can provide you with some of this assistance to help you prepare your application, and we will continue to help all applicants in these areas once the fund is distributed. We're happy to provide you with a communications advice. And for the fund awardees, we will provide a blog template or press release, as well as a social media kit to announce your award. Again, for any requests for assistance you would like, please email nursinginnovations@aarp.org. nursinginnovations@aarp.org. Next slide, please. So, how to apply? Sounds good so far? How do you apply? Applications should be submitted as a PDF to nursinginnovations@aarp.org by 10 p.m. Eastern Time on Wednesday, June 30th. All funding decisions will be made by a review team consisting of Campaign for Action leadership, staff, and other advisors. Next slide. When you go to the Nursing Innovations Fund landing page, you can access the request for the proposal, application, and frequently asked questions, which we will continuously update as additional questions arrive, especially during this webinar. I'm sure you'll have some questions that we'll add. Again, between now and the due date, please direct your questions to nursinginnovations@aarp.org. Lynn Mertz and Nicole Roscoe are supporting this work. Thank you for joining. This is next to the last slide. Thank you for joining us today. And we would now like to open up the session to your questions. Use the raise hand feature and we will call on you. This feature can be found in the upper right-hand corner of your screen. And to ensure the best audio, please keep your line on mute and your video unless you are speaking. So with that, I think we will open it up. And I'll leave this as was, this is the final slide, as was mentioned in the beginning. If you missed a section of the webinar or would like to pass it along to a colleague, you can find the recording and any additional webinar resources by going to our website, campaignforaction.org/webinars. And always, as always, follow us on Twitter, Facebook, and sign up for the campaign update. So let us see now. I am going to get back to our slides here. And here we go.
So we don't have any questions yet, but, you know, here we go.
Okay.
Wynn's responding that the Wisconsin Action Coalition engages the Madison our Urban League.
Area, sorry.
Oh.
Madison Area Urban League. So I'm responding to Diana Mason's comment.
Okay.
And Sue, I just wanted to add some clarification to a statement you made about the equity, diversity, and inclusion.
That's right. I knew. Yes, exactly. Why don't you go ahead and do that? I knew I misspoke on that particular one.
That's okay. So, so we are, as Sue mentioned, we are giving preference to the Action Coalition applications, or the applications that from the Action Coalitions that have now as your co-lead, so you can invite new co-leads. It just doesn't need to be 2 co-leads. For members of the Equity, Diversity, and Inclusion Steering Committee, they are comprised, that is comprised of the president of the member organizations that are part of NCMNA, which is the National Coalition for Ethnic and Racial Minority Nursing Associations, and the EDISC, our Equity, Diversity, and Inclusion Steering Committee, also includes the American Association of Men in Nursing. So it's the National Black Nurses Association, the National Association of Hispanic Nurses, the National Alaska Native American Indian Nursing Association, the Philippine Nursing Association of America, and the Asian Pacific Islander Nursing Association, and the American Association of Men in Nursing.
Jennifer, can we take the slides down? I'd like to be able to see people.
Sure, Lynn, please take them down.
Oh, wonderful. I love seeing you all. I miss you all. Put your, oh, there. Hi, Joy.
Joy.
Sophia, Jane, everybody.
Hi, Lisa.
Hello.
Deb, everybody. Pat. Lisa.
Laura, all the way out in Hawaii.
Hey, yeah. Well, okay. So any questions about this? I'm really excited that this is coming to you at the same time as the report. I think you'll have a lot of material to use, a lot of recommendations to work on, and I'm just really excited how all of this came together for you all. So I'm curious, not that you have to give away, what you're working on, your big secret here, but I'm curious of any new organizations that people are going to try working with, or you're working with now. I'd love to hear some of these, these organizations, non-nursing, and maybe you're working with them now. Who are you working with now? That is perhaps not a nursing organization, but it's really helping you with some of the thinking that's going on. Just talk.
Yeah, if you want to share, just pull off mute and speak up.
Yeah, pull off mute.
This is Ayla. We have a relationship with the Partnership for African American Churches.
Cool. And
It's a
who
really
is
good
that?
idea.
I can't see, I see some, but not everybody. What about some of others of you? Maybe, I'm a big believer in, the best learning occurs with all of you talking to each other. So what are some of the other organizations?
Mary Dickow is saying that Sacramento Native American Health Center and faith-based organizations.
Wow.
That's great.
Okay. Awesome.
Yeah, I'll come off mute for just a moment. Can you
Of
guys?
course you will, Mary.
So not just them. I mean, we have a whole new list in California, and I know I owe a list to somebody at the AARP level, so I apologize. But we have really expanded our thinking and reach, especially because of underserved communities and the vaccines. This triggered just a whole new set of partners. So really excited about that.
Really great. Right.
So
yeah.
what other partners do you have, Mary? Since you said you have a whole list full, because people are listening. Maybe they.
So what we've done is we've really started to partner with smaller community-based organizations. This morning we were on a call with the San Bernardino Center for Youth and Community Development, and they have many people in their catchment for clients. And so we're doing that, and we developed a way to reach out county by county now in California. So we have a strong foothold in about 8 of the 14 regions that we've identified for the state. With these smaller community-based organizations or churches or in particular in California, farm worker organizations now. Really a deep relationship with both the Sacramento associations as well as individual farms.
That's awesome. That's awesome.
Yeah, it's been really fun.
Yeah. What about some others of you? You don't have to name a list. One other organization perhaps you're thinking of, or maybe you have a question. Maybe you're wondering whether you should reach out.
This is Lisa in Georgia. As we were talking about this, I've started brainstorming about what we could do in Georgia. And, I was just wondering, I wanted to ask if anybody has any sort of relationship with the police force, because, we're the home of the tragedy of Ahmaud Arbery. And 2 weeks ago, I attended the funeral of one of my graduates whose brother was shot by Decatur police. And, we're all grappling with this. And it came to my mind about what role nursing could play in these tragedies that keep happening over and over. And so I was just wondering if anybody in all of our states had reached out to the police in any way with trying to help them to deal with this issue. And I didn't know if anybody was working with them in any capacity.
Wow, great question. Anybody?
So, hi, this is Teresa from Utah. Just a random thought. I am the chair of the Police Civilian Review Board for Salt Lake City. And I think if we could reach out to nurses to get them to serve on those kinds of boards,
great idea.
That's that unique place. I'm always amazed. I regularly say, and as a public health nurse, I see that, of course, I talk about being a nurse all the time, but that's an awesome opportunity that we might leverage as well. I like that idea.
I know, because
that's a great idea.
My graduate's brother was having a mental health crisis, and so they weren't equipped to deal with him, and so he was shot and killed, and we see that over and over again. The police officers, they're just not able to deal with the overwhelming illnesses and situations that they're called to. So I think there's an opportunity there.
And Lisa, I wanted to let you know there's this fantastic police officer in Savannah. I follow him on Twitter. I've been following him for about 2 years. His name is Patrick Skinner. He's there was New Yorker magazine did a spread on him in 2018. He's a former CIA and became very disillusioned with our ongoing presence in Iraq and Afghanistan, and so returned home to serve his community as a police officer. And he's, to me, the ideal police officer. He's about serving the community. He refers to everyone he encounters on the job as neighbor. Hi, neighbor, I'm your neighbor. He lives in Savannah. He purposely lives in Savannah. And when is responding to a 911 call, he takes the name and the phone number of the person who placed the call. He calls them and on his way and introduces himself, gets firsthand information from them so that he has more direct information. And when he arrives, he introduces himself. He says, "Hi, Mr. Jones. I'm Patrick. We were just talking on the phone. So tell me more about what's going on." And he also does some of his own assessment, like, is this a domestic issue? Is it not a domestic issue? Is this a mental health issue? Should I call for Lisa Eichelberger, the nurse? Should I call for an ambulance right away, before I even get there?
Yeah.
So,
hey, Wynn, I think I have heard, and you'd have to do a little bit of research, Lisa, and maybe others who think this is a good idea. You have to do a little bit of research. I think I have heard of a program. I don't know if we've ever funded it, or I just heard it from someplace else, or it's an edge runner of the American Academy of Nurses, but there is some program where the police work side by side with nurses, or have nurses in their back pocket to work specifically on mental health issues. Yeah. Like Wynn was saying, if somebody deems the mental health issue, maybe there's psychiatric nurse practitioners. I know I have heard of that, but I just can't tell you where to go.
Okay, thank you.
Anybody else?
I'm just doing a search. I'm going to provide something from the national. I'll put a link in the chat from the National Council of State Legislators about an interesting program. I think, if my computer allows me to do so.
Yeah, years ago, I was interning as a social worker in Maryland, and Maryland stood up one of the first crisis response teams when police would dispatch a social worker and when they were experiencing a call and it involved mental health crisis, they would pair them with medical staff and social workers and nurses, I believe. And it's been written up in the literature. I can share that later too, but it's a great model for other states to replicate.
Yeah. Yeah. Sounds great. Seems
So
like, seems like something, because we are interested in policy change, brokering. I mean, you all are such leaders to be able to broker something between different organizations would seem to be nursing's sweet spot.
Mm-hmm.
And then, so Lisa Sundin, how about if you talk a little bit about what's going on in Kentucky, even though you're not speaking on behalf of Kentucky, because you're really sharing from a CCNA consultant role, right?
Yeah, I'm actually not. I think that was Jen's comment to me.
Sorry.
I could make something up, but that wouldn't be right.
Okay. Right. Good. Thank you. Oh, there's my cat.
I was responding to Lisa. Lisa was mentioning that farmers are an interesting group to work with. And I pointed out last year, Kentucky received an innovation award for their work with the Kentucky Beef Council. And they were having dinner theaters taking to farmers to talk about suicide prevention. So it was kind of an innovative model. We're still waiting to see how that worked out. We don't have the evidence yet, but it was an awarded project.
Right,
Mhm.
because they had to take it to a virtual platform.
And
You know, it's something else you might
Jen,
try
this is
too.
Maureen
Oh,
Strozen.
go ahead.
I was just going to say Kentucky expanded with working just with the leaders of the farm. They're beginning to reach out to farm workers now in their project.
Mhm.
Right. That's
Great.
right, Maureen. That's a great point. That was through some conversations with the review committee, remember? That's
Yeah.
excellent.
So something that you might want to try
Yes.
too, if you don't have something in mind. Of course, I'm putting my grant maker's hat on. This wouldn't work with a large foundation like Robert Wood Johnson Foundation because it's just too big and too many layers, but a small one in your community, it would be interesting to go to that funder and just introduce yourselves or on the phone or whatever, or Zoom. Yeah, I guess we can't go in person these days, can we? But set up a Zoom call and say, look, I'm part of this. Tell them who you are, who you represent, the Action Coalition, and you had this grant opportunity and wondering because grant makers they're always noodling around with what would work, what should they fund? They don't know. They look to their community for advice. And maybe together you can come up with something and maybe something they love and they'll say, oh my God, yeah, we'll provide matching funds for that one. That's easy. How much do you want? 25, 50, 100? Because I think there's just a lot of money now for health equity and people are looking for ways to spend this money.
As we talk about Allison Bradywood just posted, as we talk about nursing service serving as brokers between groups, I reminded of recent conversations regarding the developing role of school nurses to able to better manage the mental health and COVID issues of middle and high school students. The need to interface differently between desks of health and education is certainly needed these days. Absolutely. Pat, do you want to speak to that at all?
Hi, yeah, it's Pat. I think there are, for some of you, there are a lot of opportunity with your school-based health and your school nurses in your states to do exactly this. I'm sorry because I was not reading in the chat, but I think that is something we've talked to quite a few states about. Exactly what Sue Hasmiller just said, and I'm not going to call the state out right now, but we had a recent conversation. We just said, reach out, be the convener, tell them you have this grant opportunity. The grant opportunity might provide you a way to bridge over. And that's what's happening. And it can go pretty quickly. Sue's exactly right. The counties, states, governments, small providers that have a lot of even small grant makers and foundations around them, they're really looking to get into this work. And you can be the conveners and the brokers, but school-based health would be a particularly strong place to do that. And, we don't know what's in the NOM report, but, all of the hearings and meetings we had in that year before COVID for the NOM report, the committee heard a lot of this work. So it's really important. And I think you could definitely be those people.
Mm-hmm.
So Mary Dickow has noted that, thank you, Pat, thank you very much. Mary Dickow has noted that Oregon has a police partner program.
Mm-hmm.
So who in Oregon, Mary?
Well, I know it's in Eugene because that's where my niece lives, who's in nursing school. And it's called CAHOOTS, CAHOOTS, capital, I forget, it's Crisis, I forget what the acronym stands for exactly, but I just remembered it. So I put it in there in case. And I don't know if anyone on the call is on from Oregon. They might know more.
Mm-hmm.
Great.
The other thing that's coming to mind, this is Pat again, might be a bridge that is already established in pretty much all of your states now, and that is the SANE program, where the nurses are the sexual assault nurse examiners, they're specially credentialed. But that program grew dramatically and absolutely is totally and completely connected to police departments. and to social workers and others on the ground. And seems to me that might be a great place to open up the discussion. You already have credibility there, and bridge over to health equity issues. And would there be an opportunity to put another layer on that program, or to discuss the possibility of using this grant opportunity, to do something in communities with, the people that are most affected by structural racism? That might be a very easy bridge. Again, it's about, just opening the door and starting to talk. But those programs are live in every state, and they're also connected to state health departments in a lot of cases. So, you'd have a lot of people to bring in partnership wise.
Mm-hmm. Great, Pat.
Obviously what we're trying to do here too is, this is not about just you all having benefit of all of this other thinking, which is good in and of itself. We need to broaden our thinking. Multi-sector partnership is going to be a big part of achieving health equity for nurses, but it's also in reaching out to the other organizations. It's talking to them. Maybe for the first time, this has been a nurse who has talked to them about health, but it's inserting ourselves into the agenda of the social determinants as well. So I really see this as a two-way fence, a very, very important fence that we need to be on both sides of.
So, so Lisa, I don't know if you've seen the chat, but several other folks have. Okay, good. And then there are also other examples of school-based nursing, health, and behavioral health resources in the chat for the Action Coalition folks who are thinking of going along those lines.
Mm-hmm.
Yeah, and I'm really excited because, of our work on the Nurses on Boards, wonderful work there. I think that has tremendous possibilities for us helping, I'm not sure who it was that talked about serving on those community boards.
Yeah.
Those community review boards. I think that has huge possibilities too, because that's sort of after the fact though. So I think we need to come at it from multiple dimensions too, helping them in the field because they don't want those things to happen. I know that in my heart. I think we all know that. They don't want these horrible things happening in our communities. And those review boards, are on sort of after the fact. So I think it needs to be a multifaceted approach, of course. But I think helping those nurses serve on those community review boards is really important too.
Yeah, that's a big goal here, isn't it? It's a very big goal with all of us. Yeah. I don't know what you can make out of a project with that, but whether it's after the facts or during or whatever, that's very, very important.
Yeah.
Mm-hmm. There was Melanie from Michigan posted early on about a new partnership, a new relationship they're having with the Capital Area Health Alliance, focusing on health equity. Melanie, are you able to share a little more about that?
Sure, I'd be happy to. So the Capital Area Health Alliance is a organization located in Lansing, Michigan. It's a 3-county region. They, for many years, have had one of their smaller pillars of work was around nursing workforce. That's kind of how we've been connected with them in the past. But they have a network of formal sustaining partners, but also many, many, many community partners. And they have a new executive director who he and I have met, and we have started exploring. They actually may become our co-lead for our Action Coalition, which we're hoping that happens. But we've been talking about a possible couple projects that we might work on in the health equity arena, at least within our Tri-County region. And ideally, it would be something that we could then, build out and potentially scale out to other communities.
Sounds fabulous. Right.
And there's lots of threads on mental health in school, high school, middle school. Definitely, I know Pat started doing some work with the school nurses,
Wait
right?
again. Okay, hi. You can take a seat. Did you get on your mask?
Oh, looks great.
Yes, and Pat, so Eileen,
Okay.
somebody
Sit
named
there.
Eileen without a last name is
Work on
talking
photos.
about
Okay,
looking to
picture
partner
notes.
with care and aging residents and is mentioning the Sash model.
Conference, so sorry.
Yes, because
Little.
we've been talking to New Hampshire. I think
Good.
that's New Hampshire.
Yeah, I
have
would talk
been
to New Jersey,
in
Ed
on-
McAdams.
Yep, ongoing discussions. Yep.
You know,
So
if
do
you
you
really
want to
do get
explain a
into
bit about the Sash model for folks who are not familiar with more of the aging and care world?
Okay. One of the things that we are doing is part of, I'm sorry.
We need people to mute their lines if you're not
Yeah.
talking.
The beauty of our modern day way we meet, it's great, right? So very encapsulated. We are working through with ARP, who strategically is looking at sustainable, replicable programs for better health. And one of those programs that we uncovered or discovered was the SASH program, Support and Services at Home, that stands for, that's been working in Vermont for the past 10 years, successful. And it's a home health model, and it has a portion of nursing embedded in that program. And so as a result of that, we have a long-term care services supports choices group in the Public Policy Institute, where CCNA resides at ARP. And we'd be happy to talk to any of you. We have up to about 20 states that are very interested in this work, and 10 that are already kind of more than dipping their foot in the water. And it's an ideal relationship for any of you as ACs. If you would like to, please get in touch with me. We'll be happy to talk to you about it. But it really is, it's something that we believe is part of social determinants of health, since housing is one of the primary social determinants. So we're very actively working on this across the entire country, and working with federal partners like CMS and CDC, all of whom are very interested in this work, and it's natural for nursing. So,
Thanks again, Pat.
I would say for those of you who are going to have a conversation with a local foundation, to really stress that this is a competitive process. I hope all of you apply. I hope to get some really fabulous projects in. But to relay to them that this is a competitive process, that you really want to say that you have this person interested in a particular program, and they want to do the matching funds, and everybody gets their hopes up. See if you can talk to them in terms of, if this doesn't come through for you, would they be able to do the entire 50 or 75 or whatever. It's just sort of managing expectations with the with your other funder, and really keeping them on the hook in an excited way about whatever you come up with. So, anything else?
I would. So can I make a couple of commercial announcements?
Yeah.
I sent an email out to the listserv today about our June 3rd and 4th summit. And so Lisa, you look a little quizzical. You should definitely have received that. Okay, so it's we are hosting our action coalitions and national stakeholders, and we hope to have several government, federal government representatives as well join us for deep dive conversations, or as many as possible, as deep as possible conversations, and maybe even starting some strategic thinking and ideation around the National Academy of Medicine recommendations. Because it's virtual and we're doing deep dive conversations, we do need to limit the number of attendees. And so we are asking the action coalitions who have more than 2 formal co-leads that you identify who the 2 most important people are to join us for those 2 days. So it's June 3rd and 4th at 12:30 to 4:00 p.m. Some people opt out to get the listserv. So if you didn't, you will get the listserv at the end of today if you didn't get it already, but I sent it a couple of hours ago, this message. So I need the 2 Action Coalition representatives by close of business this coming Tuesday on May 4th, so that we can send the appropriate people the save the date. And you can easily remember May 4th because it's the May the 4th be with you day.
There you go. We're going to be the force.
Another commercial announcement is about funding. And so a week from today, we are hosting a representative from the from HRSA's Division of Nursing and Public Health, Tara Spencer, as well as a representative from the National Health Service Corps. So HRSA's Title VIII programs and the National Health Service Corps were very, very historically generously funded in the American Rescue Plan. There's a lot focused on more diversity in nursing for those programs. The National Health Service Corps, for people who are not familiar with it, this goes to clinicians who are physicians, nurses, nurse practitioners, probably some of the other APRN groups, and other clinical sectors. Thank you, Scott. Scott has put the link for signing up for next week's webinar in the chat. And they, about 11% of the National Health Service Corps funding goes to RN and APRN funding. So we're looking at hundreds of millions of dollars just through the National Health Service Corps. And it goes to loan repayment programs if you if a nurse serves with a clinical site associated with the National Health Service Corps for 2 years. So it's loan repayment and I think some living expenses. So it's a very, very good program, especially for new graduates to get some excellent clinical expertise as well as financial support. So we will be featuring both of these folks a week from today on May 6th from 3 to 4 p.m. Maybe it's 4 to 5 p.m. Scott? Scott has already started my next meeting, so but Scott has provided the information in the link, and we are co-sponsoring that. It's 4 to 5. So we are co-sponsoring that webinar with the National League for Nursing and with the American Association of Colleges of Nursing. So please join us. And please let me know who from your action coalitions, who the 2 people are from your action coalitions, the 2 co-leads from your action coalitions who will join us on June 3rd and 4th. And may the 4th be with you. So I have to go to an Equity, Diversity, and Inclusion Steering Committee meeting, so I'm going to hop off.
Yeah, I think we're at the end of time. It was so good seeing all of you who came
Really
to
good.
us by camera. And I'm imagining what all those initials mean at the bottom and seeing your smiling faces. We hope to get a lot of great projects in. If you need any help, do not hesitate to reach out. Be on that launch on May 11th. and let's all continue to be all in this together. Okay. Bye, everyone.
Bye-bye.